This is Tara Hope, and I'm doing my Module 3 reflective blog post. And I wanted to talk about the leadership skills questionnaire that I filled out. And I scored highest in interpersonal skills area, and then conceptual skills, and then lowest in administrative skills. I feel that I could use my interpersonal skills, strength, to be a good leader at work and to motivate my coworkers and make my place of work a better place to work. I thought that I could work on my administrative skills. I just don't have as much interest in administrative skills as I do more problem solving type tasks, but to be a good leader, you have to incorporate all of these abilities. So that was something that I found that I could work on. And for my practice experience, I looked at the article Eat, Walk, Engage by Mudge, McRae, and Cruikshank, which was published in 2013. It was a study about an interdisciplinary collaborative model to improve care of hospitalized elders. I chose this journal article because in the inpatient setting we see a lot of geriatric patients, and we do see many cases of hospital-acquired delirium, and I often wish that I could provide better care to my geriatric patients. And the study focused on some of the care aspects that we know are important, such as improving nutrition and stimulation during meal times, early and more frequent ambulation, and more cognitive stimulation to help reduce the frequency of delirium. It was interesting that they found in this study that the length of stay for these hospitalized patients was shortened by 3 days. So the quality of care was better for the patient. They had a shorter length of stay, which was also better for the hospital for throughput through the unit. So using this interdisciplinary collaborative model was really helpful for meeting goals of care. They used physicians, physical therapists, speech therapists, nurses, CNAs, care managers, and they actually also created another job called a multi-professional allied health assistant that they added to the team, which had a focus on encouraging oral intake, mobility, and socializing with the patient. So I thought this was a really interesting study of how using an interdisciplinary care model can really be good for patients. And to be a nursing leader, using such a model would mean working closely with many different healthcare providers to reach a common goal. I think that my strength and interpersonal skills that I uncovered in the leadership skills questionnaire would be an asset to me in the role of a leader in that type of model, but I would have to look at developing my conceptual skills to improve my ability to look at the big picture of the whole plan of care for patients on this type of a program. So that would be something I would have to work on. And being a nurse manager and managing and acquiring the resources needed to have a successful team and efficient unit could be a challenge. Some of the skills that I identified as being needed to acquire resources would be coordinating, organizing, and planning, which were all skills that they talked about in Chapter 7 of our text. The manager will have to coordinate with the leadership team above them regarding the amount of financial resources that are available for the year and how many more positions can be filled, and then has to coordinate with human resources department to hire new staff. And I know that our unit manager is frequently in contact with the managers above him regarding approval for travel nurses to work on our unit to fill staffing gaps and how many more nurses and CNAs we can hire. So that's one example. Also, the manager has to organize the resources that are currently available to save money and be able to cut down on waste. So an example of this at my workplace is when our manager used the skill of directing to direct us to be sure to scan out all the items we were taking out of the supply room and not to overstock new rooms for patients coming from the emergency room, because these were all little things that were adding up to actually a good amount of waste. So he used his planning skills as well as his organizing skills and directing skills to help with our budget. And you also have to be able to be an excellent planner to use resources wisely, because you have to be able to understand and plan and know what resources you're going to need and kind of anticipate how those needs are going to change over time so that you can actually allocate and secure resources that you're going to need in the future. And as far as how that relates to the skills for the leadership questionnaire that we did, an effective leader is really going to need all three of those areas of skills. You have to be able to do the administrative skills, to oversee documentation and be sure you're meeting quality requirements and the day-to-day functions of the unit, which you have to do to be able to manage your resources, your staff, your budget, your inventory, and to keep staffing levels adequate. You have to use your interpersonal skills to try to keep your employees happy so that you have less staff turnover. And you have to use your conceptual skills to incorporate how you're running the unit with the vision of the greater organization. How I would use published literature in the process of being a manager is that we can learn from the studies that have been done on what makes a good leader and what helps an organization function to better do our jobs. And in our textbook, it talks about that there's quite a few different management theories in the literature, but there's three areas that they've identified from the literature that are common to a lot of these theories. One of them is that organizational structures have to be flexible enough to allow employees the freedom to be able to be creative and problem solve and be able to do their jobs well. Also, managers have to have some control over their employees, some input into their employees' work for the work to be effective. But on the other side, they also have to be able to trust the employees to be responsible and take accountability for their own work. And so this is one way that we can take what we've learned from research and from management theories and incorporate that into our practice to make our management more effective. And as far as the levels and departments that you need to work with in order to be effective in the role of a leader, like in my example would be the leader of a acute care unit in a hospital. The departments that you work with is really most of the departments in the hospital. As a unit manager and leader, you have to work with the top levels of organization to promote their vision and to accomplish the goals of the organization. In your unit, you have to work with middle management for quality control and staffing. You're working with nurse supervisors, like the house supervisors of the hospital, for your staffing for the unit. And when there's a surge in the emergency room and the emergency room's full, then you have to promote discharges from your unit to make room for the patients coming from the emergency room. So you're coordinating with emergency room services, you're coordinating with the house supervisor, you're coordinating with case managers to make those discharges happen. Surgical units are coordinating with the OR to be sure that there's room for the patients after they come out of the PACU. You have transport services that you have to be monitoring the quality and efficiency of the transport of your patients. And then you work with housekeeping services because they're keeping your unit clean and tidy to meet standards for like when Joint Commission or CMS comes. You're working with your medical staff department to be sure that if there's any complaints from patients about physicians, that those are getting addressed, and if there's any complaints from physicians about staff on the unit and working with nurses, that that is addressed. And you're working with your finance department for budgets for the year and goals, and to be able to know the finances that you have for getting more equipment and inventory. So really for my example, I'd be working with all the departments in the hospital in some way or another, in some fashion. You're also working with top, middle, and lower levels of the organization to be effective. And as far as a preference for vertical or horizontal structure, It's kind of hard for me to imagine healthcare models that are only vertical or only horizontal. As working in the hospital, our textbook talks about how in the horizontal structure part of it, you have your surgical services, your outpatient services, your radiology services. You have all these different units and services that patients are utilizing on the horizontal level, and then you have your vertical structure for your management team. You have your top CEOs and vice presidents and chief nursing officer, and then you have your middle managers, and then you have your nursing unit managers, and then your nursing unit supervisors. And so you have a vertical chain of command, and then you have also this horizontal structure for all your different services. But the text was talking about in a more horizontal structure, when you have less pressure from the top, that allows for more creativity in the units, and for doing work in a horizontal structure, there's less authority at the tops, stifling creativity, and kind of being that authoritarian figure on top. So that's a benefit of having a more horizontal structure, which I would identify with more with my personality. So if I had to pick a preference, I would say a more horizontal structure. And as far as a particular model, like the different models that the text was talking about for nursing care delivery, I guess I would say the team nursing approach, and that is the approach that I'm most familiar with from my work experiences. I did think it was interesting when it was talking about the care management model that it would help utilize resources more efficiently and have more cost savings for the patient, and that there would be kind of a timeline and goals set for the patient's plan of care. And if those weren't being met, then the barriers would be identified, and that this would help cut costs. And with healthcare being so expensive, I think the care management model is something that is just going to become more important in the future. But I'm most familiar with the team nursing model, and so that would be my preference right now. And that is my Module 3 blog post. Thanks for watching.